first thing we have to establish when we do dentures is that the body needs structural balance. And you have 7 planes going through the body, and they're all horizontal to the floor.
Right.
And so in all dentistry, whenever you're dealing with more than just one tooth, when you're dealing with a whole arch or both arches, or when you're dealing in people with chronic pain and symptoms of headache, neck and back pain, other chronic pains, and you're dealing with the mouth in relation to that, the mouth has to be, the structure of the teeth, basically the way they meet, the maxillary arch has to be horizontal to the floor. And then you match the lower jaw to the upper in the horizontal position to the right height of the teeth. Those are the 2 critical areas in dealing with people in chronic pain. In this section we're going to discuss how important it is in constructing dentures for people to have them level if they want the people to be able to eat with their denture and be free of pain under the denture and then pain in their head, neck, and shoulders. And when the denture is level, then the body can operate properly. If it's not, they always have problems. And if the teeth are canted in any way, they'll have sore spots underneath their denture always. Okay, so now we know the importance of having the structures in the body level. The main structure in the body from the standpoint of dentistry, and actually from most professions, is that the maxillary arch has to be horizontal to the floor. When the maxillary arch is horizontal to the floor, you can gain structure in the body, in the head, cranial bones, shoulders, hips, and the muscles that operate from top to bottom in the body. So it's important in doing denture work that the dentures be made so that the maxillary arch is horizontal to the floor and the mandibular arch is then fitted to the upper arch in the proper position for vertical dimension. And just as an example of what got me so interested in doing the aligner work was years ago when we developed this concept. I had several patients in with different problems. I had one man came in, he had soreness under his denture, and of course he had soreness in his head and neck and shoulders, and he'd had dentures for 22 years, and he said never been able to eat for 22 years, hadn't eaten a good meal in 22 years. And so I put took impressions in his denture that he was wearing and put them on the aligner and showed that the maxillary teeth in that denture, instead of sitting horizontal, were sitting canted up, in front, and sideways. So they were sitting in his mouth like this instead of like this. And so I cut the teeth off of his denture. We're going to go through how to do that in a few minutes. But I took the teeth off his denture after I got his case all mounted up on the aligner, cut the teeth off and put them back on level with quick cure acrylic. And then I relined the inside of his denture. He had a negative ridge, no bone up here in front. It was actually negative here, big tuberosities in the back that waved in the breeze, and his gums were beet red. And he said couldn't eat. So I leveled his denture, realigned his denture to that level, and he went out for lunch. He called me back about 3 hours later and said he was going home. He left about 4 hours away. He was going home. I said, why are you going home? He said, I ate my first meal in 22 years, and nothing hurts. Okay. He came back 3 months later, and this fellow, when I first saw him, he was about 6'6", and his head, instead of being square like this, his head looked like it had been delivered with a forceps. His head was crooked like so. So his head was just squashed like this. His shoulders were tilted like this, and his hips were the other way around. He had had back problems and neck problems for 40 years. His wife said ever since they'd been married, he'd been complaining about his neck and back problems. Well, after wearing the denture that was level to the floor, to the horizontal, for 3 months, when he came back, his head was straight and his shoulders were straight, and he didn't have any problems with his neck and his back and his hips anymore. And his dentures, his gums underneath his dentures were light pink, normal texture and normal color, and they looked real healthy. And he had no sore spots, no nothing. He'd been chewing with his denture, and now he wanted a new denture. I took an impression with that denture, put it on the aligner, set the teeth up over my noon hour, put them in his mouth. He liked them. He went home. He came back 3 months later, and I gave him his new denture. Those are the only 3 appointments I've seen him for. He promised me that he would call me if he had any problem with his denture, any sore spots anywhere, any problem. I'd be the first one to hear. I've never heard from him. That kind of situation had never happened to me before, having the system of the aligner and being able to make the denture horizontal to the floor. I had another lady came in. Her husband brought her in. She was, they were a retired couple, and she was suicidal, and he didn't know what to do with her. She was depressed and suicidal. He didn't know what to do. He thought she was going to commit suicide or something. She was so bad. She wore dentures. She had an upper denture and a lower partial. So I mounted her upper denture on the aligner, and her upper denture was, instead of sitting horizontal like this, it sat at a cant where the back was canted way up, and then her lower partial was kind of flat. So when she bit down, she could only hit on the 6 front teeth. Nothing touched in the back. None of the posterior teeth touched in the back. So while she was there, and I had her denture, I cut all the teeth off the denture, and I just put a wedge in the back so that the teeth that were sitting up, the denture was sitting like this. And so I just took the teeth and I put a wedge in there of quick cure acrylic to level the horizontal on the denture. And then I leveled the lower partial to it with composite filling material. Sent her on her way. Her husband called me the next day and he said, my wife is just fine. I said, what do you mean she's just fine? He said, well, she's not depressed and she's not suicidal and nothing hurts and she's just fine. That was one day. I could go on for several patients that I've treated with just taking their denture that they came in with and leveling their denture on the aligner, sending them on their way, leveling the upper denture on the aligner, leveling the lower denture to it at the right height, and they've done just overnight almost amazingly well. I could talk to you about several patients, but I think a couple examples is good enough. I want to go into now how you do this with the aligner. So this is the aligner. I think you've seen a picture of this already. This is the table that we mount the upper member of the upper arch with. We have a pin and a rake, we call it. The rake fits in slots and the pin fits here. They're 15 millimeters high. And then we have a series of plates. I'll get one out here. We have plates that slide onto the aligner, and we have a pin here that you tighten to tighten that plate on there so it stays put. And then when we take an impression, most important thing in the whole system is taking impression where you can get the hamular notches and the incisive papilla in the impression. Now you take an impression right back. This is at the distal part of the maxillary tuberosities, and there's a notch there that's formed by the sphenoid and the maxillary tuberosity. Lesser wing of the sphenoid sits in here. Palatal part of the lesser wing of the sphenoid fits in there. There's a little indentation there. Now if you take the impression with a material that's slightly stiff, not real stiff, but slightly stiff, you will get that depression, and then you get the incisive papilla right here. Now when we were developing this system, we looked at several skeletons, went down to the university and measured out several skeletons, and we put a plate across this imaginary plane here where you would, if you took a flat surface and put on these 3 points, and we looked at that, and when the skeleton was erect the way a man would be standing, that was horizontal to the floor. And on several skeletons we did this, and every time when we did this system right here, and you looked at the skull when it was that way, it was nice and horizontal to the floor, erect the way it was supposed to be. Now if your head is not sitting erect on your shoulders, your eyes are going to try and keep you erect always. And so if you have a plane that's off, then your eyes are constantly trying to correct that by tightening muscles. And that's what the whole program about it is freeing people up from all this muscle activity that causes headaches, causes neck pains, back pains, causes structure imbalance in the body, cranial structures in the body, the cranial bones that are not correct, maybe they're out of position, shoulders that are always correct where they got head leaning forward, scoliosis in the back, lordosis in the back. If you get the maxillary plane horizontal and you put that into the mouth and you get the lower fitting to it the way it's supposed to, then most of these systems in the body correct because the muscles relax and they go into natural structure, and all the structures go level. And that's what happened on several of these people that I took their present denture, leveled them, and sent them home with them. Actually, the denture stayed level, and their head, their cranial bones rotated right around the denture, where they had crooked heads and crooked eyes, crooked mouth. After several months, the denture stayed level, but everything rotated around it. And they came in, and when they had shoulders that were crooked, the shoulders were straight. If they had a neck that was sitting forward, the neck was up on their shoulders the way it should be, just by creating a horizontal position in the plane of occlusion that was correct for the body. So we take an impression and we get the hem of the notches, the incisive papilla, and then to mount these, we put the notches for the hem of the notch on the rake, and then we put the pin where the incisive papilla is, and then we have a plate up here, just like this one here, have a plate in the top, and then we would put some plaster in there and close the plate down, and then you have, when you do that, then after that plaster sets, then you have the maxillary arch. Then you have the maxillary arch sitting like this. When you take the rake out and the pin out, you got a maxillary arch sitting like this. Okay, now in essence what I visualize is, what you've got is, you've got the head sitting on top of this, the aligner, with proper orientation, and now you have to make the denture horizontal to the table here, because the table is on the horizontal. Now you'll notice the way this is mounted here, it's real low here and it's real high here. In other words, if you made the denture without having the aligner, the natural tendency would be to make the teeth angled up in the front. Okay? And when you have a person like that, and every time they swallow, if their teeth are angled up like that, every time they swallow, their head goes like this, just slightly, goes like this. Because the eyes want to look forward, the teeth are at a crooked angle, the brain is always trying to correct that crooked plane, and so it's always using muscles to do that. And after a while, the muscles get sore, after a while, everything gets distorted. So now, after we get the maxillary arch mounted up here, we make our wax rim to go back to the patient, and when we make the wax rim, we just make the wax rim flat to the table. So now, if we set the teeth, we cut this wax off here and set the teeth, you would have the teeth set on the horizontal. But what you do next after you get your wax rim made, and you can get some ideas where you want it. You can measure from the incisive papilla up here, up into your frenum up here, and you can take a measurement in the mouth so you know approximately how high to make your wax rim, and you can make your wax rim to that height. And whenever we mount these on the aligner, there's a horizontal column here that goes up and down. And if you look in there closely, you'll see there's MJ and O. And MJ is what they call mounting jig position. So whenever I mount an upper arch, I always set this horizontal column to MJ. And then when I mount the lower to the upper, I change that to 0. I turn it down, I change it to 0, because that puts the teeth in the middle of the aligner. I'm going to use it to set teeth. Dentures, you can put that anywhere you want, but it's good to know every time you mount a case, if you mounted it at MJ, you always know where you mounted the upper. So if you lose a reference, you can always go back and you got a reference point. So now, when I make, like on this one here, I mounted it at MJ, and then I made my wax rim approximately where I wanted to make that wax rim for the mouth, to go to the mouth. And when I did that, I had to, when I made this to the height I wanted it right in here, I closed this down. Instead of being at MJ, it's at +2. So I would mark that in my chart, that the maxillary teeth are set at +2. So anytime I went back to check the teeth in that denture, they would be set at +2. But then what I do is now I take my wax rim, I go to the mouth, and I take a torch with me, or I heat up the wax, and I put it in the mouth, and I determine lip fullness and cheek fullness and where I want my front teeth on my wax rim, just like you do for doing any denture work. After I've got that set, it gives me the fullness in my cheeks and my lip. I mark where my incisive papilla is, or right in the middle where I want my front teeth in the middle. I mark that on the wax. So I got basically where I want the buckle of the teeth set in my wax. You can do it any way you want to. You can use phonetics. You can look and see how much height you want in your teeth when they smile. You can do all that with your upper arch and determine in the wax where you want your teeth set. So after I do that, I've already got my upper impression mounted. I'll put this back on my upper impression. I take a 3x3 post-it, or I take a computer label, a 3x3 computer label. I stick it on to the table, put a little tape across it in front here. I put my teeth on there. I put my teeth on it. Okay, now what I got this vertical column set where I've trimmed my wax rim to. My wax rim now is trimmed to where I want the teeth, buckles of all the teeth to meet, and where I want the height of my 6 anteriors to be. I've got that in the wax. Now I've got that on the table for setup. So after I've done that, I take this off and I make a mark on the table here. You can see it. This is where I want my teeth set. And when I do that, I put a mark where I want my centrals to be, right the midline. And oftentimes I'll mark where I want a cuspid and where I want my cuspid eminence. Now when I set my teeth, I don't have to worry about setting one tooth at a time. When I set my teeth, all I have to do is heat this wax up, cut the wax off, and push the teeth into the wax. So this is a different setup, but so this is a different setup that I've done, but I would have my teeth now set on here. After I get my teeth set on here, I go back to the mouth and check to see if my teeth look the way I want them to look. If I want to change any of this to make it a little fuller on one side or a little narrower on that side, I can do that. Put it in the mouth, get it where I want. I can go back. I can go back to the aligner. I've got my teeth reset. All I have to do is take a red pencil, make a red mark, and that's where my final setting of the teeth belong. Okay, when I do that, I don't do all the festooning. I get the teeth where I want them and where they look nice, and that's where I end it. Then I can send this to the lab man. The lab man has a mark there where the teeth go. All he has to do is festoon the teeth, clean up the wax, do the final setup, but he never loses track where every tooth goes. It's real quick, it's real fast, and it's real easy. If I'm going to set teeth in this, what I do is take a torch. I just have a torch, little torch, and I'll just heat the wax up. I just heat the wax up, and I take a knife, and I just cut the top off at an angle like this. And then I heat the wax up. And let's see, I'll use some of the teeth off of this setup here. But then what I would do is I would just take the teeth. And just set the teeth in. Just take all the teeth and set them in. I just take all the teeth and push them in. And I can heat the wax as I go. And I usually use, this dark pink is base plate wax, and then when I set the teeth for the denture, I would set them in setup wax. Setup wax is softer and everything pushes in real easy. I make sure that my vertical column is set at 2. I set those teeth in and just kind of squeeze it in. And as fast as I can heat this up and push them in, the teeth are set. And then I just, you could just set them like that. And as fast as you can push the teeth in, you can set them in. And you would never lose track of where they belong. Get your upper teeth set, you can take a bite registration. You can either do it before you set them or after, and you take a bite so that you've got your lower where you want it. It doesn't matter how you take your bite. Then you would put your plate on the bottom. You'd have the lower one set to the upper one. You'd put it upside down. You'd close it, put stone in between the two. And then you'll have your lower arch set to your upper. And then once that's done, if you've got your lower arch set on the upper, you just start setting the teeth the same way. Now this one I don't have mounted right now, but you would have one of your mounting plates on the bottom. You would have your mounting plate. You would have the lower arch to where your bite registration was, and then you would just start setting your lower teeth the very same way. You would set this down, and I've already started this setup, but say you had your lower one set to the upper, and you would have that set. You would have this in here set at 0. So you'd have that set at 0. You'd put your stone on. Close the upper to the lower. Then you would have your upper set to your lower. Your upper is already set. You're going to set your upper to your lower. And then you can do that with the wax rim. That's the way I started that. I put the wax rim, mounted the wax rim to the upper setup. I got this set where I wanted it, and then I went back to the mouth with the lower wax rim to determine where my lower fits to the upper in proper height and where the teeth go. And then I put them together, and then I just started cutting out the wax and putting the teeth in. It takes 10 or 15 minutes to put all the teeth in there. You close the lower teeth into the upper teeth right where they belong. And then you got your lower set to the upper where you've got your upper teeth set. Then as fast as you can heat that wax up, you just push all the teeth in, close it down to make sure your lower teeth meet your upper teeth where you want them to meet. And once that's done, you go back with the final setup to the mouth. You try the lower and the upper in and make sure you the patient likes the looks, make sure the teeth are in the right position buccolingually. And the beauty of the thing is you never lose track of where the upper teeth go, and if you never lose track where the upper teeth go, you never lose track of where to put your lower teeth to them. The only other thing that we haven't discussed on doing a setup is, do we set this up to a class 1 bony or a class 2 bony or a class 3 bony arch? A class 1 bony arch is when the eminence is just the slight angle eminence. A class 3 bony arch is when the eminence up here where the condyles work is real flat. If it's flat, those people slide straight forward. If it's at an angle, they come down when they slide. So in a class 3 situation, when the patient got a class 3 where their lower jaw just slides forward and backward, you would put 0 degree or 10 degree teeth in there. Usually flat plane 0 degree teeth in there. If they're a class 1 where when they go to chew, you don't chew with your condyles up and back in the fossa. As soon as you start to chew, the condyles come down and forward off on the eminence, and that's the way you chew, and then you go sideways. Well, if they have a flat eminence, it doesn't matter. They just slide forward and backward. If they've got an eminence back here that's got an angle to it, then they slide down on that, so you would want to use 20 degree teeth. If they're a class 2 deep overbite case and they formed that way, to where the eminence is steep here, and the condyle is sitting up in that eminence, when they go to chew, they have to come way down to chew, so you would put 30 degree teeth or 33 degree teeth in that denture. And it won't knock the denture loose if the denture is horizontal on the horizontal. Now, if your denture is canted one way or another, no matter what you put in there, they can't chew, because the denture, when it goes sideways, when they come forward, will not work properly. But if you got everything on the horizontal, chewing is not a problem. Like the fellow that said he hadn't eaten anything for 22 years. Well, when he was on the horizontal, at the right angle of the setting of the posterior teeth, which is a slight off the table for a guy like him. He had this deep overbite for years, and his condyles were really angled up into the eminences, and so he had 30 degree teeth. I put 30 degree, when I made his new denture, I put 30 degree teeth in there. But even when he had his old denture with 20 degree teeth, he could still chew with it, because you put a slight curve of speed in the denture if they're a class 1, and you make the curve of speed just a little heavier than that, or a little more than that in the class 2 setup, so that when you look at the teeth, you've got just a slight curve from front to back in the way you set your posterior teeth. You don't set them absolutely flat on the table, but horizontally, just a slight difference depending on a class 1 or a class 2 setup. And then those people can chew with their denture, because when your jaw unlocks and comes forward for chewing, and for a deep class 2 case, they have to have inclines to chew on, or they can't chew their food. By the same token, if you have a class 3 setup where the jaw just slides forward and backward, and you put 30 degree teeth in there, they're going to slide forward. They're just hitting on the tops of the teeth. They don't have inclines to chew on. So when you set, you have to consider when you set your setups whether you're dealing with a bony configuration, mostly in the joint back here, whether it's a flat eminence, a slightly angled eminence, or a steeply inclined eminence, as to which way, how much curve of speed you put in the posterior teeth when you set them, and what degree of teeth you use when you do the setting. But the beauty is you never lose track, no matter what you use, you never lose track of your vertical dimension and where your teeth belong. So setting up the teeth is extremely easy, extremely quick, and when you have an aligner and your lab who processes the dentures have an aligner, or when I do them, I just ship the aligner into the lab, and it's all marked. He never can lose track of where the teeth are, and I do all the primary setup to get the teeth in the right place, because it's so fast and it's so easy. It's just real quick. And so, but if I don't do that, at least I send the rims mounted on the aligner with a pencil mark where the teeth go, so the lab man knows where to set them. And I have the height vertical set with my wax rims to where I want it. And then the lab man, it's so simple for the lab man, he never loses track where the teeth belong, and he can do the setup and festoon it, send it back to you and have you check it, and everything is correct, so you just send it back and have him process it. So that's the system, which is so convenient, so easy, and when you do this, you're doing the patient such a great service, because you're putting them level. The rest of the body now structurally can go into balance, and they don't get the sore spots under their denture, and they don't get the sore neck and back and shoulders from trying to chew with a denture that's not level.